seen each other on Zoom calls for, yes. Yeah. At some point. Well, and it's been within a lot of other people too. So, well, it's we were just saying, many hands make one work. So, you know.
I mean, these partnerships are just extraordinary.
Yes.
Hi, Emily. Hi, Commissioner Malcolm.
Yeah.
Good.
We were at the point where, you know, we're kind of preparing for 9/11 and, booster shots for existing vaccine clinics.
Doing well. Got some snacks downstairs in case I need them. And at the house.
Yeah. And then, quite frankly, how are you going to do all that?
I feel like today
We got the
I know. I came out here the other day and I definitely had to like hide.
We're down in Florida, unfortunately.
Oh, really?
My son got a great number of hours. Away they went.
And you know what? And
So yes, we did go down and visit them. Huh?
what did I answer?
Oh yeah.
How are you?
I know it was bad. We went down in September. We're gonna go down again. They're coming back for Christmas. That's telling me we were supposed to be like 4 days thing, and then we're gonna go down sometime. We went down in September. The second one was born down there in July. So she was 6 weeks old.
Have you been? Was it short? 18 months ago? Oh, I love it.
We rented a
My son is starting to get a
VDO.
I love it.
Well,
However long the pandemic has been around, it's how old my child is.
You kind of had to just see the new
Hopefully that changes. Yeah. It is.
all this is where
When I was in, when I went to the hospital, it is after
Yeah.
the hospital. Sure.
Oh, jeez. That just shows you the coast.
I know.
Is he you?
It's like it's a standby.
Hey, you want to roll on my stuff? What's that?
Well, Jerry's like, she just sent me the she's like, keep it tapped. That's all she really wrote. Keep it tapped.
At that time, it was like, retire. It's a good leadership opportunity. What if I
Hi, Jan.
Hey, Governor. How are you?
Director Bromo, yeah, congratulations. Pleasure to meet you, and thank you for your work. So, good to see you again. Bobby's here. We got the band back together. Jesse, we were just talking about you. Shoulder Charlie.
Oh, yeah.
So, yeah, good to see you all. Thank you. It's to having this infrastructure ready to shelve and then bring off the shelf quickly is really a great thing. So we appreciate that collaboration. I was just mentioning to the Colonel how we hear from families how the convenience part of it, just to know, you know, you had an event, now you want to know if something happened, especially with your kids. So I hope you're seeing families come through here. That's good.
Not this time of day, but later.
Yep, that's what we're saying, before and after. That's the convenience of trying to do it and to spread it out and closer to home. And if we know people are more apt to test if the barriers are reduced.
Absolutely.
Yeah.
Let's take a look how this one operates.
Come on in.
I'm thinking this might be the only armory in the state I've never been in. See it start.
Get this first. Absolutely. A lot of young kids testing, and I've been training the guard on how to be gentle with everybody.
Yeah.
Kind of walk them through the process.
So look like when they come walking through the door.
They come they check in for swabbing stations. We are a rapid testing site here. We have our processing area over there because results are sent out within 2 hours.
Great.
And then
And are we getting them out within 2 hours if folks are here?
Absolutely. Yesterday. So we're really
That's fabulous. That is fabulous. So
This site has a 500-person capacity, I think. Once everyone gets comfortable with the whole process,
here you just sent. Where troops?
So I've got a mixture of soldiers and airmen, honestly, Governor, from all over the state. So what we did is we kind of asked for some volunteers first to not create a hardship on the National Guard.
That's right.
So we've got from all over the state, but a lot of the Stillwater facility are. A couple of them are, and they'll be able to help support just like you all asked us.
Great. We requested about 70, is that right?
That is correct, Governor. I do about have 70 on duty for all the other locations that we are standing up as well right now. So at this facility, we got about 20. Down in River Heights, we'll have roughly 29, and then the outstate one's got 13 at each location.
doesn't know, I think everybody's skilled in different basic skills and train them up to what you need.
Yes, that's correct, Governor.
So,
Yep.
that's fabulous. Well, we're grateful we're here. So,
We're excited.
thank you. Thanks for doing this. It's important work. Take good care of them, get them on orders.
We did, Governor. Yep. Yep.
Good.
We got some good food and all that too.
Yeah.
That's understandable.
When you're this young, you're not thinking about retirement points, but
That's correct.
so
It is definitely added in.
it is adding in, so that's great. Well, we appreciate it.
Yeah, sure, Governor.
Any questions? Folks?
Thank you. And as a mom who has utilized rapid tests for my kiddo who can't be vaccinated yet, it makes a huge difference for peace of mind for families. So it's great.
Great news. You're welcome. Yeah. Yep.
Good. I'm glad to see those numbers are good. I'm glad to see that many already. So it says something. Yeah. We really wanted to habituate people to just using this and living with it. Just stop in if you're not sure. You're in a now. It's what we do. We have our dual mission. So you all feel it. And so when people come here, it makes you feel a little calmer when we're partnered with our private sector folks.
Yeah, proud.
No, thank you so much. I hope you're enjoying it. It's been quite a couple of years, huh? So,
Other duties as assigned, right?
Sure.
Yeah.
Yeah, that's right. You know, you got to do it. So.
I had the privilege of serving in uniform with Lieutenant Colonel when I was in. So
Oh,
we
really?
shared time together. So he's younger. He looks younger than he is, maybe. So, but it's good, that connection, and I think for all of you, I hope you're feeling it, that sense of the sense of gratitude that Minnesotans had. Because I'm sure many of you spent time down in Minneapolis on a few nights, and
Yes, absolutely.
you have been. Some have been in long-term care facilities caring for our parents, in addition to going to NTC, and then you've got folks spread across the Middle East, and really important work you're doing. So really appreciate it.
Thanks, sir.
So yeah, stay safe.
Thank you. Thank you.
Thanks everybody. Yeah, great.
He has a really good dog. A golden doodle. Yeah. I'll tell him you say hi.
Yeah, I was actually.
That facility's gorgeous. And it's the fire department took on too. I'm just curious about the facility. No, I don't know why I missed this. I know I was telling Jam that when I used to come here, it was the downtown operating there. Colonel said his dad comes from there. So we went to the old, and it was so cramped and crowded. So they said we're doing it in Stillwater Army. I said, I think they upgraded that facility.
Yeah.
When did this open?
Major Morgan, do you know when this facility opened?
I was admiring your facility. My only experience was the old one.
Yeah. I believe it's 2007.
And it hooked in with fire.
Yes, yeah,
And then
that
you
one they've opened, absolutely. Yep, so there's a shared space, there's some office space actually that the fire department uses on a regular basis. So we do have a shared, got it called an emergency operations classroom that we do share. And so we just, buy time to use that on an intermittent basis.
Great, really great. So thanks for hosting. I know it kind of ups your routine, but I was attacked the one
Yes.
in Nebraska, so this is like rent it out, run it.
Right, yeah, exactly. And we did have one schedule conflict, but other than that, we're, everything's driving and all the scheduling issues out with the team here, and then it's extremely accommodating. So
That's great. And we're feeding our troops right here and everything?
yeah.
Great. Great. All right. We're ready.
Okay, Governor, Lieutenant Governor, Lieutenant Colonel, and then if the mayor comes.
The mayor gets here?
Yeah, we'll very good.
All righty. Well, good afternoon, everyone. Thank you for joining us out here at the Stillwater Armory. Lots of thank yous. We're going to use this as an opportunity to tell Minnesotans that our rapid testing sites for COVID-19 are open. We're using those structures. We kind of pulled them out of mothballs and opened back up again as we're seeing the Delta surge. But it really highlights the partnership and the capacity that we've built across Minnesota. A thank you to our National Guard partners, General Menke's team, and of course it's being led by Lieutenant Colonel Dowdy and his team here. We want to thank you, Major, for opening up the armory here. We have our public sector, our private sector partners in here with Abhi and his team that we've seen again. We have public health out here, and Director Brummer, who I understand came on how many days ago?
4 days ago.
4 days ago. We're in the middle of a pandemic, when you took the public health thing, so just so you know. But to see this community step up, this is one of the sites. Mayor, good to see you. Thanks for being here. Mayor Kozlowski, and thanks for the community for stepping up. This is one of 3 that we have stepped up with the use of the Guard that we talked about last week and being in the middle of this surge. Both Hutchinson and Crookston will come online next week. We'll see Wadena, Inver Grove Heights, Albert Lee, others start to come online. What I would encourage Minnesotans to do is these are rapid tests where you will have your results within 2 hours. Come in here, bring your family in. The folks running it told me it's about 15 minutes in and out maximum. You can sign up online or you can just do walk-in. Here in Stillwater, they've done about 100 or so already. You can imagine it's probably before work, folks coming at noon, folks after work. But the importance of this for Minnesotans is this was part of when we talked about with the COVID pandemic being with us and with the advent of the Delta variant, being able to try and live your lives and manage, having your kids in school or daycare or going to events or gathering together for celebrations, one of the things you need to do is keep in those mitigation efforts. Obviously, first and foremost is get vaccinated, wear masks when in indoor spaces, and then testing if you think you have anything. And as Lieutenant Governor said, it might be a sneeze from allergies, might be a seasonal cold, but what we need to know is if you have it or not so you can get the proper care if you need to, and of course isolate so we don't have a spread in this. While our numbers seem to be somewhat plateaued, we still have work to do. We continue daily to lose several dozen Minnesotans to something that we have a lot of say over to prevent now with all of our mitigation efforts with our vaccines. So it's great to be out here. It's great to see this. I think for Minnesotans to see the capacity that's been built between the National Guard, between our private sector and our public sector health folks, it makes for a very convenient, very easy, and I continue to remind folks, this is free to you to use. We keep the barriers as low as possible, and in the cases of these rapid tests, they're saying here that in every case they've been getting out results in 2 hours or less. So by the time you get home, you'll get your text and know where you're at. And I think many of you, especially with family, I see this with a high school student, but Lieutenant Governor Flanagan talks often about her 3rd grader and how the capacity to be able to use this, and I think that's a message that Minnesota families know that this is out here and will help. With that, Lieutenant Governor Flanagan.
Thanks so much, Governor. Well, good afternoon, everybody. It is a beautiful fall day, and I'm so grateful to the Guard for stepping up and doing this work and being ready for other duties as assigned over the last 20 months and for really stepping up. But as the governor said, I'm here primarily in my role as a mom. For a while, right, many of us, when it came to daycare or to school, if our kid wasn't feeling so great and we knew we had to get to work, it was, I'm going to give them a little Tylenol, say a prayer and send them out the door. And we are in a moment where we can no longer do that. if our children are exhibiting any kinds of symptoms, we need to get them tested. And making sure that we have access to these rapid tests is one of the ways we can have that peace of mind. The turnaround, as the governor mentioned, in less than 2 hours allows families to be able to live their lives. And especially for our kiddos who are not yet eligible, they will be soon, but are not yet eligible for that vaccination, these testing sites are critically important to making sure that we are stopping the spread of COVID, but removing as many barriers as possible for families to try to get the testing, the access that they need. So we're really excited about our ability to be here today. As we are in, as the governor mentioned, we are in allergy season, cold and flu season. This is the time. Know that these are available to you and to your family, and it's just critically important to make sure that we're utilizing these tests and not sending our kiddos to school when they might be exhibiting symptoms. And because I'm standing in front of you and talked about the cold and flu season, I just want to encourage people as well. Now is the time to also get those flu vaccines. For our kiddos who are under the age of 12 who can't yet get vaccinated for COVID, we want to make sure that they're getting vaccinated for the flu at this time as well. But it's super easy. They're in communities. These testing sites are in communities all across the state. We are so grateful to be able to have these available for folks. And so don't hesitate. You can get this test, this fast turnaround, families can come together, get that peace of mind, and stop the spread of COVID. And with that, I'm going to ask Commissioner Malcolm to come on up.
Let's have the mayor.
Oh, Mayor, well, welcome. It's so good to see you, brother.
How are you? Hey, thanks everybody for coming out. I'm excited that we're doing this testing. It's great to have this in our community for the residents of Stillwater and the surrounding area. I'd encourage people to take advantage. Like our governor and lieutenant governor have said, it's kind of that cold and sniffle seasonal allergy type season right now. I would encourage you to use this. It sounds like it's really quick, painless, in and out, rapid testing. With everybody back in school and kind of hunkering down for the winter, I just want to encourage everybody to take advantage of this great location that we have out here and thank the Guard for all their efforts and working with our health commissioner to make all this happen. So thank you all.
Thanks, Mayor.
Thank you, Mayor.
Good afternoon again, everybody. It's really been so nice to be able to come here in person and to see an example of what's going on. As the governor activated the National Guard just a week ago and asked us to speed up and ramp up our rapid testing capacity to see what they've done and how quickly, and they make it look so seamless, but I'm telling you, these are miracles every day that they're able to pull off these kind of logistics. I was really, really happy to hear that, and we'll hear from the Lieutenant Colonel about the response of the community and the Guard. I just want to comment briefly. We're coming on to 20 months that we've been dealing with this pandemic, and everyone is beyond sick of it. And we want so badly to be done with the pandemic, but the pandemic is clearly not done with us. We are gratified that we've seen a slowdown in cases in recent days, but I really love this about the governor. He's such an optimist, and he knows I'm always the one to say, a few days does not a trend make, and we really need to, stay on vigilance, and we are. And part of that, one of the real hallmarks of success, I think, of this whole pandemic management strategy has been, certainly our aggressive vaccination campaigns, and we're going to do it again with 5 to 11, but also this really impressive testing infrastructure that was built at the governor's very specific direction. And the Guard played a great role in that earlier, and they are coming back to help us again during this surge. We've got community sites, and the governor has asked us to stand up some more, and that's happening quickly. I want to thank also Director Brummel, who's here, and gives me a chance to just thank all of our local public health leaders across the state who are such a bedrock of our response on the ground. And in addition to these sites, some of these are specifically rapid testing sites. We're also putting rapid testing into several of our existing community-based sites that have been saliva-based. 16 local public health agencies have also stepped up to add rapid testing into their availability. So just to reinforce the Lieutenant Governor's point that this is truly needs to be and will be, is statewide as another critical tool to just help families with the navigation that both the governor and the lieutenant governor and the mayor have talked about, how important it is to be able to distinguish COVID from other things, particularly at this time of year. So, you know, I just really urge Minnesotans to take advantage of all the tools that we have in the toolkit, including testing, and just the incredible value of continuing to push on vaccination. We've got a ways to go yet with our vaccine-eligible 12 to 17-year-olds, but continue to make progress there, and are very, very much looking forward to the beginning of vaccination for our 5 to 11-year-olds. And with that, great thanks to the Lieutenant Colonel Doty, and please come on up and share. Thank you.
Thank you. Thank you, Commissioner. Thank you, Governor and Lieutenant Governor and Mayor, for allowing us to be out here and making some comments today. I'm Lieutenant Colonel Doughty, so I'm serving as the officer in charge of the mission. We got nearly 70 Minnesota National Guard soldiers and airmen that reported for duty on Monday, October 18th. This was in response to Governor Walz's order to support the COVID-19 testing mission. Our soldiers and airmen are currently assisting with rapid tests in Stillwater, Hutchinson, and Crookston at this time. We are prepared to support at least 4 additional sites next week. Our soldiers and airmen are our greatest strength, and they are trained and ready for this mission. The Minnesota National Guard, we value our partnerships with other agencies like the Minnesota Department of Health, and we are committed to serving the communities of Minnesota. We remain grateful to support our families and the civilian employers, as the mission cannot be accomplished without them. We remain on alert to support long-term care facilities as well. We remain on alert to support the long-term care facilities of Minnesota if called to serve in the capacity by the Governor. In late 2020 and early 2021, more than 300 soldiers and airmen were trained as temporary nursing assistants to ensure that the Minnesota residents of long-term care facilities received care when COVID-19 caused shortages in their healthcare workers. And the Minnesota National Guard is prepared to resume temporary nursing assistants training and to activate those that are already trained, should the help of soldiers and airmen be needed to care for our fellow Minnesotans. The Minnesota National Guard remains always ready and always there to support both our state and federal missions. Thank you.
Thank you, Lieutenant Colonel. I think for Minnesotans to understand, these are our citizen soldiers. The women and men of the Air and Army National Guard have their own civilian careers. We ask them to do a dual mission, both state support and federal support. Since 9/11 in 2001, that role has become incredibly important and incredibly complex to be able to carry out. So it's one of the things, as we think about using the National Guard, they have their own civilian lives, they have their own training, they have missions to support a federal mission. Of course, we have many troops in the Middle East as we speak, and they have their own military education to try and keep up with. So when we make these calls, it's I think a lot of folks, again, it's because of the incredible work they've done, that folks think this is an easy thing and that you just call them and they drop in and just fix things. That's what it looks like from the outside. But what I can tell you is, to make it look that easy takes hundreds of hours of preparation. It takes much collaboration and coordination. And so last week when this mission came on and we gave the warning order to have the Guard ready, that's when they kick in. They assessed what we needed, they started working with our partners, and less than 6 days later, here we are operating these across the state. I can tell you that same warning order has been given. We are gathering the logistics and the information we need now on the decompression side of our hospitals, where we start moving folks from the hospitals to long-term care facilities, that we use a multitude of things. We use the private sector to help us with that, and as last in, first out attitude with the Guard. If we need them, they're getting trained and ready to go. Keeping in mind, some of these folks are helicopter pilots, they're supply specialists, they're artillerymen, they're infantry, some are healthcare, but it doesn't necessarily coincide. And as you might guess, people think, well, just take all these Guard people who are doctors and nurses. They're pretty busy in their civilian lives right now because they're already overtaxed. So it doesn't work that way to pull a Guard person out of a hospital and put them on duty back in the hospital. So I just want to note the complexity, the ability to be flexible, the lessons learned over basically the last 20 years or so of being able to drop in these missions is amazing. So when you come out here, Minnesotans, and know that the folks serving you here are a combination of public health folks, private sector partners, National Guard, they're your neighbors. So please use this site. Please make sure you're monitoring the testing. Once again, as we prepare, and we're simultaneously preparing for vaccination of our 5 to 11-year-olds, that get the good information from your trusted health providers and make sure that we are stopping COVID. We're reducing those numbers that are out there. We're reducing the chance of either you, your family, or your neighbors getting sick. That takes the pressure off the hospitals. That keeps folks alive. So thanks for being out here, everyone. We'll take some questions.
Governor, if I may, there was a time we treated rapid antigen testing like second class because it was less accurate. Now we're promoting it in our schools, we're promoting our test sites. I can't help wondering if we've underused the potential of these rapid antigen tests to quickly identify outbreaks in the past.
Well, it's a great question. You can tell, I have to say, our journalists have become experts in health for sure. And this is a heated debate that has been going on for 20 months. And I'm going to let Jan answer the question because there's validity in what you're asking. And I think Abhi mentioned to us that we also use the backup of PCR test once we see this. So Jan, maybe clarify that, but it's a great question.
Thanks, Governor. Yeah, this has been quite a heated debate about in what kind of situations are rapid antigen tests really valuable. And these are the Binax professional tests that are being administered by trained people. They're a little different and slightly better in terms of accuracy than the over-the-counter take-them-home tests. These are specifically for symptomatic people. These tests are not highly accurate for asymptomatic people. There are some rapid tests on the market that are good for that, and we're using some of those too for repetitive surveillance kind of testing. But these tests are really good if you have symptoms, and it's really important. You know, if you have symptoms that are definitely COVID-like and you get a negative, we do recommend confirming that with a PCR test just to make sure that it's an accurate negative. But the whole thing speeds up the process of having a definitive answer much more quickly than just relying on PCR alone.
So if you're asymptomatic, would you tell them to go to a PCR testing location rather than this one?
Yes. I think for asymptomatic folks, the PCR swab tests, or there's a test called Q that we're using in some areas that are more specifically geared toward asymptomatic detection.
Governor,
thank you.
Some update on the legislative negotiations over the pandemic bonus pay package. I know that the committee met yesterday and are still deadlocked, and I know that Senator Majority Leader Jeremy Miller has indicated that a vote on Commissioner Jan Malcolm is still on the table. So just curious where that puts us in terms of a potential special session, or will we just not see one until we come off the session?
Yeah, well, it shouldn't be this difficult. We agreed in the session. One of the things I advocated strongly for is essential worker pay. I did not think it would be so easy. I knew we probably wouldn't pay enough, and it wouldn't be to as many people, but it would be a good start for folks who paid a pretty heavy price in the beginning of COVID. And also over the summer, drought conditions intensified, so we put that package together. I think Minnesotans are seeing it is very difficult right now for the legislature to get much done. They had a deadline of September 1st, and here we said on the 21st to get this done. I want to see it done. They could get it to me, we could finish it in a day. But I'm certainly not going to waste taxpayer dollars to pay them per diem and have them come back and argue again. And the disconnect between not helping us fight this pandemic and some of the things I sent over and asked them, and when I say I sent it over from the requests of all the long-term care facilities, all the hospitals in the state, all the public health folks who said these are a few things you could do, and we're having silly debates about things that aren't connected. We are in the middle of this pandemic. We are stepping up rapid testing, as Minnesota is one of the 7th highest states for infections. We lost 32 of our neighbors today, all preventable, and we are getting ready to vaccinate up to 400,000 plus of our 5 to 11-year-olds in a safe, efficient manner. Certainly now not the time for me to have the leadership who is best qualified for this and acknowledged by every single health. So I think it's been pretty clear and decided that my Republican friends in the legislature have moved on to an election, and that's where they're going to be. We do not have that luxury, nor would we ever step there. We're going to continue to focus on this. I think it's probably unlikely that they're going to come back and do anything with the long-term care, or excuse me, the essential workers or the drought, but we'll continue to focus this mission that we have.
So the follow-up, you think will be we won't see a special session at all?
It didn't sound like it. It sounded like they walked away yesterday. I just heard a radio interview with the majority leader, and it sounded like they'll walk away. It's a political messaging. Here's the deal. Strip everything else aside. Bring us the essential worker pay and bring us the drought. I would like you to do a little bit around the pandemic, like give me some flexibility in the hospital if they're asking for, but let's just say you can't do that. How about you do those 2 things that we agreed upon? They were supposed to be done the 1st September, and they're not done. I will sign that tomorrow. We'll go in, we'll sign it tomorrow. We can be out in 2 hours. I don't understand where we would go. I'm not asking them to go anywhere else. They've decided that they want to adjudicate their pandemic response. And I would just say I would like to show that group of folks what it took to put this on, what it takes to make something like this happen to keep people safe, and this whole time, not 1 minute of help. So I think it seems highly unlikely.
Governor, if I may, if you look back at November when you issued your stay-at-home order, at that time it came after the peak in cases when you look at it now. Now we look at these actions, including to mobilizing people to support long-term care, and they're coming at what could be after the peak. I'm just wondering if there's a flaw in our system where we're coming to these kind of decisions a little late in the game.
Well, I would let Jan speak to this. I don't think so, and one of the things is we're getting better at being able to tell. I would tell you that since November, being able to look at what the modeling is showing, but I will have to be honest this time, the modeling has been hazy, and I think Mayo Clinic would say the same thing. The Delta variant threw a kind of a wrench in that. I think the ability to have the testing and where people are at was there, but to make it more available, and it's a lot of this is meeting the public where they're at when they're at that point. And if they're not ready to test or they don't think it's there, it won't matter if we do that. I think the good news is once decisions are made and once we think they're at that point where we're going to see it used, and that has happened with testing going up, it follows the trend, we're ready to go pretty quickly. And I think it's a science and a bit of an art how to time this and how to get the public on board with it. I think the thing that for us, that we add into this, it's stunning to me that in November we were just hoping and praying and watching for when the vaccine would come, and then it came, and it seemed, I think, for many folks, that because that vaccine was there, we wouldn't see ourselves in this point again. Delta and the lack of uptake of the vaccine certainly showed us that we're here. So it's a fair question. I think the timing has as much to do, though, with meeting the public when they're ready to use it. Because if we stand these things up and nobody uses them, it doesn't make sense.
Governor, could I just...
Sure.
It is a great question, and of course hindsight's always, we learn from that. But an important point, I think, is it's really up to us whether this trend that we hope we're starting to see of a plateau continues or not, and how fast the decline is, and how fast we drop in cases and hospital pressure and protecting, all of our citizens. It really does depend on maximizing some of these strategies. So in no way do I think it's too late by any means, but that speed of how quickly we get to the end of this thing is still very much a question. Thank you.
Time for one more today.
Governor, there was a Senate legislative hearing this morning where some Metro law enforcement officials testified and raised concerns about the increasing violence in and around the Metro and the low officer morale. I don't know if you've heard of those same concerns.
Oh, yeah.
Is there anything any message you can send to them?
Yeah, I think we're seeing this across the nation, that crime rates have ticked up. We see these senseless crimes. We saw the situation in St. Paul, and we need to have a multi-pronged attack to this. And I keep asking, where is the plan to try and address that? How do we make sure it gets there? And I know this discussion around public safety and policing takes on a political kind of false dichotomy where it's both sides and there's not a place in the middle. I definitely share that concern. My responsibility with nearly 700 state patrol, with our DNR conservation officers, with our National Guard, of making sure we know how do we approach that, how do we have a plan. See these guns that are illegally straw buyers buying them, there's a whole spectrum of things that we need to crack down on and help figure out, but the community's going to have to feel that buy-in. The community's going to have to feel that with the police and with their law enforcement. So I certainly share that with them. I think there are some things that we can do. I would like to see the legislature come up with some concrete plans on how they're going to do that, but I think many of us know is that these law enforcement issues are unique to each community, and it is certainly the local elected officials that have a lot of say in how that works. The state is there to support it any time that we can, but our primary mission is the safety on the trunk highway systems of Minnesota, and then of course the law enforcement that goes along with the DNR. The National Guard, just to be very clear, they do not have the authority to operate in a policing environment. They need to be accompanied at any time we have the National Guard with law enforcement. So I think it's going to be a continued discussion. It'll be interesting if this is a decision to talk politically about it, or if it's a decision to talk about solutions, because I'm very interested in helping them with those.
Gotta get you on the road, Governor.
Great, thanks. Got one more?
Actually, I do. The last several days and weeks of the people that have died
how many were vaxxed and how many were not vaxxed?
Dan, do you want? We had this conversation this morning because there's privacy issues around some folks.
Yeah, and I'm sorry I don't have that exact number. What we have posted just on the website just yesterday is graphics that show the trends over time and what of the recent hospitalizations and deaths are vaccinated versus unvaccinated, and that pattern is just extremely clear. I don't have a number for you of the last 3 weeks, but I think it's pretty clear visually on our website. Thank you.
Jan, is it right out of our roughly 8,600 deaths that 500 of them have been?
It's 400 and something.
So you can extrapolate. What I always look at is you can almost certainly see, and it might come days up in that if we report 30, you can be almost certain that at least 29 of them were probably unvaccinated. That is the way this has gone. And that's the thing I think is heartbreaking for me, and that I would reiterate again. Certainly understanding people's concerns around a whole spectrum of things. The fact is these are highly effective, highly tested vaccines that are highly effective at preventing severe illness and hospitalization and death. Doesn't mean you're not going to get a breakthrough case, and it doesn't mean if you're older with underlying symptoms that a breakthrough case is dangerous. That only reinforces why all of the rest of us need to get vaccinated and stop this ability for it to continue to spread and mutate. So we encourage people. This is a testing site, but keep in mind vaccines are highly available. They're out there for you, and we should get news within the next week or two about booster shots with all the rest of us, J&J recipients like myself and Commissioner Malcolm, Moderna recipients, and then of course our 5 to 11-year-olds. So thank you all. Thanks, folks. Thanks, man, for having us. We're really grateful.
Well, it still sounded good though to me.
Thank you so much.
Yeah, nice meeting you.
Yeah, good to see you.
Thank you.
Mankato East, Mankato West last night was a classic.
Bringing it home.
23-20. The jug match. It's MEA weekend, but the jug match was last night.
Okay, thanks.
Thanks for going.